Good afternoon. Welcome to our press conference for the Bucks County Commissioners. Today, I'm here, Diane Marseglia, Chair of the Commissioners, as is Commissioner Bob Harvey, Commissioner DiGirolamo, Dr. David Damsker from our Health Department, Larry King from Public Information is here, and today we have a guest. We have Erin Lukoss. Erin is the CEO of the Bucks County Opportunity Council. They have been working tirelessly through this COVID epidemic, one of our top partners. And before we take any questions, I thought Erin could just tell us a little bit about the Opportunity Council, what you do and what you can do, because we are still in green. It is not gone.
Thank you, Diane, and Commissioner Harvey and Commissioner DiGirolamo. I appreciate the time to talk about BCOC and about some of the work that we've been doing these past few months. BCOC is the Community Action Agency for Bucks County, which means that we are the organization that works with people who are in poverty. And I would say that over these past 3 months, we've seen a steady stream of individuals who needed help. The request varied from people who needed help paying rent to assistance getting technology for school, and also for work, people who needed the very basic need, assistance of food. So I would say that, each family was affected by COVID-19 in some way, either through a loss of job or lack of childcare or increased cost of food and other household needs. And I want to start by saying I think that we're very lucky to live in a county that has the resources to help. Again and again, when I'm on statewide and national calls with other community action organizations, I am, incredibly proud of how much BCOC and how much Bucks County has really stepped up to help the people that need it the most. So that's something that I think we all should be pretty proud of. Let me give you a quick snapshot of what we've been doing for the last 3 months. Early on, we worked closely with Family Service Association of Bucks County and the Housing Department and Emergency Shelter to move families out of the shelter to create social distancing. So we worked to identify about 15 families that we could move out of there very quickly, get them into temporary shelter, where they could, safely, be socially distant, and then help move them into permanent housing. So about 39 families now that have, since the beginning of the outbreak, have moved into permanent housing, which, during a pandemic is no easy feat, I will say, but we've been working tirelessly with landlords to help do that. We have had 147 families have received rental assistance to prevent eviction and maintain housing. And even though there wasn't a threat of eviction per se, because there was a stay on evictions, families still needed to be able to pay rent, because next week, right, next Friday, when the moratorium lifts on evictions, we didn't want to see people come to us 3 and 4 months behind. And not only that, it was a dual impact thing, because we were really looking at the landlords too. They are our partners. They are members of this community, and they rely on that income to provide for their own families. So we wanted to make sure that we kept them whole as well. Through our Fresh Connect program, which is a partnership with St. Mary Medical Center, Rolling Harvest Food Rescue, the United Way, and Philabundance, BCOC kind of shifted that nice little produce program that we do every week that gives about 20 pounds of produce, and we really were giving life-sustaining food at that point. Shifted it to be giving shelf-stable food, dairy, and produce to make sure that families had what they need. So at the beginning of this, we were serving about 400 families per week, and as of last week, we were over 1,200 families every week. So we thought that, things were kind of leveling out, but I think that we're just seeing kind of people are still in need, and that food money is the one thing that they're able to, that's the budget money. That's the money that they can kind of use for other things if they need it. And so we're glad that we're able to respond to that. We've been handling that as a contact list, from truck to trunk, so that we keep it safe for everybody. And, we'll continue to do that for as long as we need to. I think the one important thing is that each week we're seeing new families come. So people that, have never needed help before and have never really expected to need help. I can personally tell you that, one of the people that struck me, because I've been out there every week for the past, 3.5 months, but one of the people that struck me was a realtor. She was our very last person one day, and we had actually run out of food for the first time. And so I had her follow me over to the help center in Bristol so that we could give her some food. And she said to me, I'm a realtor, and I'm just not able to get into houses and show them and be able to do that. And that was, probably about midway through. And she said, plus the cost of groceries is just through the roof, and I just really can't afford it. So they were super thankful to have that kind of assistance available. I think that the one kind of last thing is that we're doing home delivery as well. And so during this pandemic, we heard from a number of people who couldn't get out to sites and didn't have friends or family that could get out for them to pick it up. And so we began doing some home delivery. So we're serving about 50 families each week through the home delivery program. And they're just taking the food that we normally would give out at our distributions, and we are enlisting the help of volunteers who sign up for a volunteer shift, and we'll give them a route, and then they take it to the 8 to 10 families that we assign to them. So that has been, I think, also a helpful thing that people are thankful for. You asked me to talk a little bit about the help that's available, right? That we're seeing. I think one of the big things that we are seeing is that through the education and employment, right, are very important, and that people are starting to evaluate if they can or should go back to the jobs that they had, or do they need to retrain in something else. And so, we have our workforce development board and our career link that have switched to virtual services, which has been very, very helpful. And then the Opportunity Council has a one-on-one coach program called Economic Self-Sufficiency that we can really help put the supports in place so that someone can retrain and can get back on their feet, or can have the supports that they need to go to work, transportation assistance, childcare, all those kinds of things. I think that those are important. At rent, and prevention from eviction is still super important. I think, we anticipate that we will have more people contacting us. So we're encouraging people to contact the housing link. And again, I think it's important for landlords to know that if they have tenants who haven't paid their rent and are not sure if those tenants qualify for assistance, just encourage them to apply. If they have questions, they absolutely can contact the Opportunity Council. I think the 1-800 number is up on the county website for the housing link, so you are that is readily available for people. It's also, I think, on the county's Facebook page as well, so people know how to access those services. Our weekly distributions are done Tuesday in Warminster, Thursdays in Ottsville, and Fridays in Bristol. There's more information on the Opportunity Council's website, which is www.bcoc.org. There are many food pantries in our community, and they are operating and doing safe distributions. So I would encourage people to reach out to their local pantry, to call them, find out what their hours are. You can also look on our website and on the county's website for a map of the pantries that are closest to them, and the hours. But the hours change, so they're mostly volunteer run. So make sure that you contact before going out there. But the pantries are happy to give assistance. Our tax program, which closed at the beginning of the pandemic because we could not safely do it with, it required face-to-face contact. We have since resumed in our Quakertown office. So again, it's on our website, the www.bcoc.org, that people who have not yet filed taxes or need assistance with tax preparation, it is a free tax preparation program. And we have we have opened it up in our Quakertown office. We plan to open it also in Bristol. And the IRS has not extended the deadline for taxes. It is still July 15th. But if you do not owe money, you could, theoretically, you could file your taxes after July 15th if you do not owe. If you do owe, you should file an extension. The last thing is, how can you help, right? How can the community help? The Opportunity Council and all of the community partners. You can donate food. You can donate food to your local food pantry or to BCOC's food program. You can help a family with housing, because if you are a landlord or you know a landlord, we would love to talk with you and talk with you about all of the resources that we can bring to the table and help people find an affordable apartment, but also to stay in their homes. We always need general help with assisting people to meet their basic needs, and all of your donations to the Opportunity Council are tax deductible. So I think that that's probably the last thing that people like to hear.
Well, let's end it on that positive note then.
Yeah.
So Erin, you're here to answer questions too. So we'll go back to Larry and
Sure.
see if he has any questions for us.
Thank you, Commissioner. Our first question is for Dr. Damsker from Kara Seymour of Patch. She's wondering, in light of the expanded mask order announced yesterday by the governor's office, will the Bucks County Health Department be amending its recommendations for schools related to students wearing masks in light of this new development?
Yeah, my recommendations, besides that one piece, are exactly the same. The one piece that could change, and again, it's not really up to me, if the Pennsylvania Department of Education mandates that all schools require mask usage in schools, it doesn't, I'm not sure it matters so much what my guidance say. The school districts are usually compelled to follow that guidance. I do believe that there's some issues, especially with younger children wearing masks for extended periods of time for multiple reasons, including potentially spreading the disease, touching the masks all the time, contaminating the disease, not using them properly. And I believe that there's some real issues with that. But, possibly in high school kids, it's a little bit more appropriate. But again, my guidance isn't going to change from that perspective. But if the school districts are required to do it from the Pennsylvania Department of Education, they're going to do it.
Thank you. Now some questions from Kazra Zareh of the Philadelphia Inquirer for Dr. Damsker. In terms of numbers, what current trends is the county seeing with COVID-19? And what are some of your concerns going into a long, normally social holiday weekend?
Sure. It's very, very clear over the past 7 days, going back a little bit further, but certainly over the past week, we have seen sometimes a third of our cases, sometimes closer to half of our cases are from travel. These are people that went to a state like Florida, Arizona, even New Jersey, the Jersey Shore. We're seeing cases from, and they're not Bucks County spread, and we know that because people either became symptomatic, while they were in that location, or they came back and the next day or two they became symptomatic. We've also had some household transmission. There were some gatherings in Myrtle Beach. There were some gatherings in other areas where, we've seen some cases. So it's a little bit, it shows you that here in Bucks County, our community spread is pretty good. But obviously, as everyone knows by watching the news, that there's other locations, and people need to take the same precautions that we're taking here whenever they go on vacations. I think people should, at least for the next few weeks, I think people need to maybe take a second look at their travel plans. But if they do go, make sure they take extra precaution, just like they would here with respect to the mask wearing and the hand washing. And most of the places that we're talking about, the governments there have implemented new restrictions anyway. So we're hoping that those places will start to see decreased numbers in the near future. But It's clear we're not seeing a lot more of cases overall. We're just seeing additional travel-related cases.
Okay, and one follow-up from the Inquirer. As we experience the ebbs and flows of the pandemic, what numbers, besides the number of new cases, should we be looking at and when, especially as the death numbers may be lagging?
Yeah, I mean, obviously the death numbers are going to go up after the hospitalization numbers. So the numbers of hospitalized Bucks County residents is the first thing you look at, because 99.9% of the time people don't die without being in the hospital first. That's the number we're looking at. Right now, our numbers are really good. They have not gone up. I know our hospitals are getting a little bit more busy, but it's actually not COVID related. It's the normal things that people are starting to seek care for that maybe ignored those things over the last couple of months. But yes, the numbers of hospitalizations related to COVID is the first thing you want to look at. And then another thing, and we've talked about this on previous conferences, is about looking at the pure community spread numbers and seeing if those numbers continue to rise. But from a seriousness perspective, the hospitalizations mean more. We can have 1,000 cases a day, but if we have nobody in the hospital, then does it really matter? And I think that's the way we need to look at going forward, whether we get nervous or not.
Okay, I have a number of questions from Chris Ullery of the Courier-Times and Intelligencer, a few for Dr. Damsker and a couple also for Erin. First for Dr. Damsker, have there been any clear indications from the state over what conditions could cause Bucks County to slip back into the yellow phase of reopening? The State Department of Health has given broad examples, like a spike in cases significant enough to overburden the healthcare system. So how big of a spike would it take to put Bucks back in the yellow phase?
Well, obviously here, we don't technically have control over what the governor, mandates that we do in the color. But I think that what you'll start seeing is what Allegheny did with regards to cutting off alcohol sales in certain locations. I know Philadelphia has decided to limit indoor dining for a little bit of a further time. And we would have the ability here, if we saw outbreaks, at say, business X or business Y, that we kept seeing additional cases at, and those businesses weren't taking things seriously, we may look at the overall scope. But what I don't like about yellow is that it penalizes businesses that are doing the right thing. Let's say, because there probably were bars in Allegheny County that were doing what they should have been doing, and they were penalized right along with the bars that weren't. So we're looking at a more of a specific focus on the businesses, that are not doing things right, rather than, making everybody go to yellow, including the ones that are really doing what they're supposed to be doing. But again, going back to yellow doesn't make sense if hair salons and gyms and places like that aren't causing any problems. It doesn't make sense to penalize everybody. So we're looking at things that are high risk, and that's how we'll, at least here in Bucks County, that's how we're going to move forward.
Okay, another question for you and the commissioners as well. Now that Governor Wolf has ordered masks to be worn in public and not just when entering businesses, some of the exceptions in the order appear to be very similar to exceptions in the business safety order. So is this change significantly different from the business safety order, or is it akin to a small addendum to existing rules? And are the state police in charge of enforcing the new rule, or does it fall to the municipality or the county?
And I'll just say right off the bat that I don't believe, if you really look at what it says, I don't believe it's going to have a huge impact on a lot of what we're doing here in Bucks County already. As you said, Larry, most of the businesses are already requiring masks. Most of the people I see in general are wearing masks out in public. This is just sort of making it more important by making the entire thing in order. I mean, there's still some guidance that has to come out. I was a little disappointed, actually, that it didn't come out with some of the guidance at the same time. We've gotten calls from basketball leagues and camps and other facilities that are thinking, do we have to have our children wear masks while they're playing sports? And I unequivocally say that they should not be wearing a mask while they're participating in sports. Obviously, if you're walking into a facility, the team, wearing masks when you're crowded walking into a building, that makes a lot of sense, obviously. But once anyone is engaging in an activity that requires them, to potentially be ill from wearing a mask, And I just don't have a belief that that's what we want to do here. And I believe that hopefully the governor's guidance will sort of come out and clarify that. But overall, I think it just brings it out to the general public. It's not just the businesses now. It is, everybody needs to wear a mask. And I think the overall idea behind that is a good one. But we just need to separate out, some of the real questions that are coming from places like camps that are trying to run, and to make a kid at 110 degrees, play duck, duck, goose with masks on, I think it's a little bit, not realistic. So your second part of the question, enforcement, the state police are the ones enforcing most of the governor's order, and they may not be able to do so. I think this order is more about, hey, we all need to do this together so we don't, have more cases. But the health department can certainly follow up in areas that we have licenses on. And we can obviously, if something's a major threat to public health, we can assist in that situation. But I don't believe the municipalities will be enforcing this either, unless it's in conjunction with something that we're trying to do.
I'll just say real quick, I don't know if my colleagues have a remark. I have to drill down a little bit more on that order, but it does concern me a little bit that with kids wearing masks when they're trying to have exercise. You said duck, duck, goose, but kickball, when you really have to run, is a concern. I would just say to the adults out there, this is why it's really important that you wear masks. I know I got an email from someone today encouraging me to sign a petition that we should not at all wear masks. And that it's, I had to fight not to respond because I want them to understand that this isn't about a choice anymore for adults. You just have to do it. Commissioner Harvey or DiGirolamo?
Yeah, I think obviously we just rolled out yesterday, a push through the poster that was made, actually made it front page of the paper today, and we'll be using it throughout the county about, mask up bucks. Certainly that was done, just the timing of that was sort of coincidental with the governor's order. We didn't know the governor was going to put an order out until after our meeting was over. But I think what we're all trying to do is just remind people that this fight isn't over. Yes, we've moved from red through yellow, now we're in green. Every business is now open to some degree or another. The weather's nice, so people are getting out more. And obviously the cabin fever has caught up with everyone, and the Zoom fatigue and everything else that's going on with people is making them sort of let their guard down a little bit. And we see what's happening in other states. And it is having an impact on us, as Dr. Damsker said, where people are going to other states where the mask requirements aren't as strong, or they're engaged in activities that they're just not thinking about the mask anymore. They're tired of thinking about masks, and they're starting to feel like, okay, we're through the worst of it. Let's kind of just try and get back to normal. But we still have to be disciplined. We still have to wear the masks wherever it's appropriate to wear it, as long as it's safe. Protect yourself, protect other people. And I think that's what the governor's order is about, is reminding us that we have to stay on top of this.
Yeah, just to add on, I think Dr. D explained it pretty well. And again, I just think we have to use a little bit of common sense. And as the doctor said, if you're going inside for whatever reason, shopping, that you have to have a mask on. I think we still need a little bit more direction from the governor's order, but I think of what he's saying also is that when you're outside and among people in some kind of setting, that you need to wear a mask outside as well if you're not going to practice social distancing. And I think important, the message we got to get to our young people is that please wear a mask. A mask is important. I know, probably because you're young and you look at the statistics and you see that young people are not really the ones that are dying from this, although there are a number of cases where young people have gotten severely ill and died from this. But you got to remember our young adults and our teenagers, that if you're not wearing a mask and you do get the COVID, that you could possibly be giving it to your family members, your parents, your grandparents, and other people that you're engaging with. So to our young people, extremely important that you wear a mask all the time and follow the guidelines that are out there from the state and the county. Larry?
Thank you, Commissioner. Question for Erin. Are there any particular challenges brought on by the pandemic that you are concerned might become long-term problems? And what would the council need to curtail those?
Well, I think there's a couple of things challenge-wise. Employment, I think that, people are certainly challenged with either getting back to work and making sure that they have the resources that they need to return, and or starting a new career, retraining in something different if their job is no longer sustainable. And so I think that it's important to help people find career paths that can help them sustain their family, right? So that they don't need to rely on the government subsidies, but most people want to be able to take care of their family. So I think that that's, for sure going to be a challenge. I think childcare is a challenge for people. We are hearing great concerns from our low income population about school schedules. And if kids are going to be, half virtual and half in attendance at school, or having these staggering starts, what's that going to look like for them as far as employment, especially for our frontline workers who can't work from home, right? Who don't have that luxury of being able to work from home, and they have to show up to work. So if their kids are scheduled at different times, I think that that's going to be a challenge for them. Food is most certainly a challenge. I think that the cost of food has gone up considerably, and that even if people were okay and their job situation didn't change, the cost went up for them, and so their budget is stretched a little bit further. And the question about what will we need what would the Opportunity Council need to help curtail them? I mean, really, it boils down to funding to help people increase their income. So funding to help people work through the steps that they need to go through so that they can access the appropriate resources and be able to take care of themselves. I mean, those are really it kind of all comes down to that, to helping people through with funding.
Okay. Thank you, Erin. Also from Chris Ullery for you and also the commissioners. Do you think that the widespread economic impact of the pandemic will change people's attitudes toward poverty issues, and how so?
Well, I hope so. I hope that it does change people's thought on poverty or attitudes on poverty. I hope that people realize that there are many, many people that are just one step away from falling into poverty. And that it's relative, right? It's about a lack of resources, not always a choice. Sometimes I think people have that misconception that, people choose their plight and they choose to be in poverty, and that's simply not the case. Sometimes it's that they just don't know where to start, and that that there are all of these resources out there, but it's overwhelming for how to access them or how to get started on their future. And so I really do hope that it changes people's attitudes. And, we are in the third wealthiest county in the state. And, we have a relatively low poverty rate here at 6%, which is, fine. But I also think that it could be much lower than that. And, but I think that, it's awareness. It's helping people understand that, poverty exists, and that it's not necessarily what you have in your mind of what poverty is supposed to look like, that it could be the people next door to you that are just don't have enough to make ends meet. They have enough to keep a roof over their heads, and maybe that's the extent of it, but it doesn't mean that they're doing okay. And so I think that I do hope that. I hope that it does change people's perception.
I do too. It's the greater angels out there for people. I think there are a lot of people who have experienced this, like your numbers going up to 1,300. You don't go through something like this and come out of it unchanged. And I think a lot of the people who we saw who became angry at the whole shutdown and everything, a lot of that is because they felt out of control and were having financial problems. And it just registered as anger because there's a lack of control. So, I also hope that there'll be a difference in how people look at things. I have gone through this and, we continued to work, but thinking so much about what it was like when I was a young mother and what I would have done had I lost my job. I remember those days of paycheck to paycheck, and it's very difficult. You can end up a step away from absolute poverty. Jean, did you want to say something? And then Bob?
Yeah, and again, as Erin said, there is a lot of need here in Bucks County. And, I served up at Harrisburg, and there is a lot of need around the state of Pennsylvania. And I think it's important that we keep the issue of poverty and hunger and homelessness and healthcare at the front of our discussions with all of our elected officials, whether on the state level, federal level, and even on a local level and county level. I mean, we've got to keep those issues. They've got to be important issues to those people because they're making the decisions in Harrisburg and Washington, and even on the local level in some regards, into whether to keep these programs going. And I just don't think anything makes me angrier when I see talk in Washington or Harrisburg on cutting some of the programs which serve as a safety net for families that are really in need, because there is an awful lot of need. And we've got to make sure that we keep those programs running. And especially healthcare is another important issue, making sure that Medicaid is funded and that we keep getting the federal funds necessary to make the Medicaid program work here in Pennsylvania and across Bucks County. And again, the third richest county in the state of Pennsylvania, as Erin said, but boy, do we have an awful lot of need here in Bucks County to help people out.
Yeah, we are the only state in this part of the country that still has not raised its minimum wage, the only one. And I think what you've seen, and Erin's talked to this, as have Jean and Diane, the fact that we just ended earlier this year, we came to the end of 10 years of economic growth, throughout the country. And while a lot of people are very happy about that, and everyone's trying to fight to take credit for it, the fact of the matter is that the pandemic hit, and all of a sudden we started seeing a lot of people all across the country who missed that one paycheck, and they were in lines for food for their families, and they were in danger of losing their homes and losing their apartments, and finding themselves without the ability to get access to healthcare, to get the medications they might need for them or their families, or to get the food they needed for their families. We have to really kind of question how strongly the pillars of our economy are if one paycheck puts that many people in serious financial jeopardy. So there has to be some changes, and I'm hoping that just as you see the debates about systemic racism and things of that nature coming out of the George Floyd incident, I think this pandemic should have exposed a lot of, and I think it has exposed, whether or not people want to actually look at it is a different story, but it has exposed the economic faults that we have in our system that we really need to pay attention to and fix.
Thank you. One that I missed from Chris Ullery for Dr. Damsker regarding masking, and that is, can you give an example of the type of health condition that would make a person unable to wear a mask in public? I understand that neither the business order nor the new order requires anyone to provide or to prove that they have a condition to avoid wearing a mask. I'm just curious if there are certain conditions that tend to pose an issue for people, or if it's more of a case-by-case, everyone is different kind of thing.
Yeah, I think it's really important that it doesn't just have to be things like asthma or COPD, other lung disease that you think. Some of those people can probably wear masks just fine. But there are people with lung disease that can't. There's people with claustrophobia. There's people that literally just can't wear a mask for extended periods of time. And we can't expect those people to wear a mask at all times. So remember, this order is being put out in general, right? So even if most people wear masks, it's sort of the whole idea that we're still making a big difference, right? Even if 10% of the people aren't able to wear masks for whatever medical reason, whatever situation may be, or at a baseball game, if the kids can't wear masks while they're playing, or a basketball game, the idea is most people are wearing masks. And the people that can should, and that will sort of give us this overall reduction of spread of coronavirus. So I don't want to get too hung up on the medical conditions, because there are people that don't have a physical condition but may have, claustrophobia is actually it's a perfect example. So we just can't wear one. There are other things people can do. I believe in the order it does say that face shields are an acceptable alternative, and they should be. People can wear a bandana that sort of doesn't rest on your face as tightly as a mask. So there's things that people can do, there's things that people can try that would make it more doable. But again, there's people with all kinds of conditions that can wear masks that you think might not, and there's people that have other conditions that may just don't feel comfortable wearing one. They get short of breath. Whatever the situation is, we don't want to be judgmental on that. We just want most people to do it, and we'll be okay if that happens.
Thank you. So today we're without our PPE expert, Scott Forster. So of course we have a PPE question, but I'll throw it out there for Dr. Damsker in case you know. This is from Tom Sofield of Levittown Now. With reports of defective PPE provided by FEMA, has Bucks County seen any problems with the PPE provided by the federal government? And did Bucks County see any defects with the PPE that it purchased?
All I can tell you is that I was not made aware of any issue. It doesn't mean it didn't happen, but I would like to think that if PPE that we gave out to a facility or other agency had issues, that Scott and I certainly would have been talking about that. So we're hoping that wasn't the case, and I don't believe anyone in the county is aware of that if it is.
As I recall, Scott vetted from places before he made orders. So I remember he was checking for that.
Finally, we have some questions from Frida Savannah of the Bucks County Herald. And to Dr. Damsker, can you address concerns about bars not following guidance in Doylestown? And even those that do or are trying, are you still concerned about that?
No, well, we're having pretty good compliance. We will be sending people out this weekend in the evenings on the weekend to ensure compliance. But my inspector in Doylestown has certainly said things are going well. And there's any places that aren't, we will be out there again this weekend to verify compliance. The 4th of July, of course, as you said earlier in one of your other questions, people are used to celebrating, having a good time. And bars are one of the places that can be overwhelmed with people that are certainly not social distancing and certainly won't be wearing masks. So as I said earlier this week, we are making this a major initiative for the health department. And everyone who has a bar, any restaurant that has that, needs to know that we will be looking, and we're hoping that everyone will just comply voluntarily, because again, as I said earlier in this news conference, if we start seeing outbreaks related to those facilities, that's going to be the first place that Governor Wolf will shut down. When you talk about going to yellow, making targeted changes. It's already happened in Allegheny. It's happened in other states, and we're trying to avoid that from happening here. Because there are a lot of facilities that are doing exactly what we're asking them to do, and we don't want them to be penalized.
Okay, and the last two questions, I'll ask them together for Dr. Damsker. How are things going at Neshaminy Manor and other nursing homes in Bucks County? And has there been any discussion of bringing back the COVID tent to Doylestown Hospital?
I can't tell you about the COVID tent. I can tell you that overall testing seems to be down to a point. We had a large testing facility. It's private run, but down near Oxford Valley Mall, they actually shut down to Monday, Wednesday, and Friday now because they're having fewer people getting tested, which of course is a good thing because our overall number of cases have come down to a baseline. And part of that reason is, as you mentioned, is that our nursing homes have certainly seen numbers decreased over the last several weeks. Our death rate has gone way down. And as most people can imagine, the death rate, 85, 90% of our deaths were from long-term care facilities. Of course, those people are the most frail of our population and the highest risk of death. And we're hoping that even if our cases go up a little bit, that our hospitalizations and deaths won't go up with it. But in general, there's no question that the nursing homes are doing much better. It's 100% better. I mean, we're seeing a few cases here and there because they're required to do testing of all of their residents and staff on a regular basis, which is put out by DOH. So we're still getting a few cases here and there, mostly asymptomatic people. So overall, the situation is 100% better than it was, back at the end of April.
Okay, that's the end of my questions. So I'll turn it back over to the commissioners if you have any closing remarks.
Okay. Commissioner Harvey?
No, I just want to thank everybody who everything that's been going on the past several months, all the sacrifices people have made in this county and all the struggles they've gone through. I know there's been people who have been donating food and volunteering at places the BCOC is operating to help put food in people's cars and do those kinds of things. We still need that. And so make sure that if you have the ability, if you can kind of go around your house, you find some food you're not going to need, or you think I have too much of this, I can give some away, or clothing, whatever it is, you can make those donations. Just hope everybody keeps their neighbors in mind when it comes to those kinds of things, and wearing your mask. We will get through this together. If we're all on our own, it's going to be much harder. And just hope everybody has a good weekend and happy 4th of July.
Gene?
Yeah, thanks, Diane. First I wanted to thank Erin for being on the program today, and also thank Erin and everybody that's associated with the Opportunity Council, your staff and all your volunteers, for the absolutely amazing work that you do here in Bucks County, helping the families that are most in need and most vulnerable. We really appreciate it. And also to all the other groups and around Bucks County, the nonprofits who are doing exactly the same thing as the Opportunity Council are doing, whatever it is in their field. Thank you for the good work that you do. You make a big difference in people's lives for our most vulnerable citizens here in Bucks County. And again, everybody enjoy the 4th of July holiday. And just remember, as Dr. Damsker says all the time, that alcohol and COVID do not mix well. So to our young people and our adults, please be careful, wear masks. You have to remember that the virus is still out there, and that we want to make sure that everybody here in Bucks County is safe and sound. So happy 4th of July to everyone.
Thank you. Thanks everybody for being with us. And once again, be safe out there as you go through this holiday weekend. This can kind of be a time where people are maybe drinking too much. And as Gene just said, no COVID and alcohol. If you get a chance, spend some money at some Bucks County businesses. They have taken kind of a hit over the past few months, and we're trying to support them. So go out and buy something. Forget the alcohol. Go buy something. Thank you for being with us. Bye.